Actually, what I'll go ahead and do is I'll read to you all the new palm cards, what we're putting on the back of them. So we've redesigned, if anybody remembers from last year, we've done a slight redesign. We've added the words strengthen, safeguard, and secure to all the signage now. And I'll tell you why that's important in just a second. On the back, they say, Jennifer is a native Cecil County nurse with hardworking family roots going back over 100 years here. She is a rare candidate in politics, choosing to focus on the needs of the people rather than simple party affiliation. Jennifer supports strengthening our communities, safeguarding our principles, and securing our freedom. Jennifer does this with a strong eye on fiscal prudence, accompanied by simple, clear American data. So that's a slight change from what you all may remember last pandemic era, we'll call it. So my name is Jennifer Pingley, and I've been a nurse for about 13 years, 14 years? Oh goodness, 14 years now. Yeah, because we're August, so it's 14 years. And I've always served the community between here and Hartford County for the most part. I've lived in Cecil County my entire life. So when I say deep roots here, I mean that 100 years ago, when they were converting the C&D Canal from a waterway with locks to a free open waterway, my family has manual labor on that. And I find that pretty impressive, and I'm very impressed myself when I found that out not too long ago. I am going to kick Andy Harris out of Congress because he's been absolutely ridiculous. And the way I'm going to do that is by showing the Republicans that I not only care about them, but I'm thinking about them in ways and solving problems that they didn't even know they had. The problem with Andy Harris is we're not just going up against your typical politician. We're going up against someone who has that aura of a doctor, that, you know, a doctor is going to look out for what's best for me, which in this case, he's not operating as a physician. He shouldn't say operating because he's an anesthesiologist. In this seat, he's not functioning as a physician. He's functioning as a politician. But that doesn't mean that people don't look to the word doctor and say, oh, okay, and still assign him the same amount of prestige. Now, in the mind's eye of the general public, there are only two people who can accurately challenge a doctor. So that's going to be another doctor or a nurse, for which I'm at your service. Andy Harris has not yet introduced a health plan, even though he is a physician. And as far as I know, the GOP has offered none since the inception of the ACA. So I don't think they're going to be doing that anytime soon. The Democrats have a wonderful idea of Medicare for all, which I agree to in concept, but we have several problems, one being with rollout and the other being with naming. So you hear a lot about Medicare has a bad name. Well, the reason Medicare has a bad name is because it wasn't meant to function the way it is now. It was actually meant to function for large end-of-life expenses. So that slips, trips, falls, that's strokes and heart attacks, things that were potentially a death sentence, and seriously potentially a death sentence, back when Medicare started. You know, fast forward to now, we've tweaked Medicare as much as we can, but it's still not giving us the same benefit per dollar and for the care provided as it did when it was born, as one would say. The reason for this is because we're living longer. We're not necessarily healthier when we're living longer, but the technology in the medical field and the expertise in the medical field has expanded to the point where slips, trips, falls, heart attacks, and strokes are no longer automatic death sentences. We can have someone with a heart attack or a stroke, and a couple days later, they're back at home. We do still occasionally have those really, really large events where it is fatal, but people are living through them at a considerably higher rate than they were previously. And then a lot of people who needed care that survived would have died because the type of care they needed wasn't available yet. We hadn't invented it. We hadn't done enough studies. And now we have, so people are living in disabled conditions much longer from these slips, trips, falls, strokes, and heart attacks. So in that concept, people get that quote unquote it's free, meaning that it's a benefit of citizenship that's paid for through your taxes. But they can't quite balance it out because it always looks a little worse every time they look at it compared to what it used to be. And that's just the nature of the beast, which is why it's important that we push something like Medicare for all. I would suggest, first of all, that we rename it. We try and stay away from the word Medicare because poor branding, we know from many, many, many businesses, has been the downfall of simple businesses. So trying to latch on to that, even though it does have history, to try and make it easier is actually, I think, sinking us. The other way to do it is a different rollout. And this is where I think we can really get Republicans on board. You hear a lot of them talk about the same things. You hear them talk about there's no American data. Well, of course there isn't American data. We don't have a socialized system of medicine in the United States. So there can't be data to pull from. So the other thing is you hear them talk about people milking the system, which that you really can't combat necessarily. But the other part is they do talk about, why can't everybody just go to the primary care doctor like they used to? Why do we have all these specialists? Well, the truth is we can't just go to our primary cares for every single thing because our technology and medicine in general has progressed past the knowledge being able to be contained into a singular human being. So basically, there's just all this knowledge and we can't put it in one person's head, let alone every primary care practitioner's head to be able to fulfill that wish. But I can use that. A lot of people have heard previously I was touting my primary care for all citizens as a starting point, and I still do. I think if we roll that out first, we do a couple of things. We can rebrand, and I like the primary care for all citizens because it hits all the pretty keywords that Republicans are liking. But it also gives us room to continue to roll out and grow and expand and take into consideration other things that are beyond just primary care, but it gives us the footstone or the cornerstone to start with. In healthcare, the primary way to actually get the costs down is to keep people out of the hospital and healthier. And that is directly tied with the number of visits and the quality of visits with their primary care providers, because it is quite cheaper and quite better for everyone if you can treat things early instead of waiting until you're so sick you have to come into the hospital for treatment. And being someone who works in the hospital who's worked in the hospital as a nurse, I see all the time where people are like, I don't have enough money to go get this treated from my primary care or specialist, but I know if I'm sick enough, the hospital has to treat me, and then I can pay them $2 a week for the rest of my life to get rid of that bill, and I don't have a problem. So they're using the system because of that financial gap. So we start with giving them the primary care to help alleviate that. And that's going to be a huge impact on bettering people's lives to keep them happier, healthier, and out of the hospital. So we have all that there. If we start that way, we can even give it the entire project a beautiful new name like American Health Matters, which I think was used before, but it's a really good name. And then we have data. We have American data about how socialized medicine works in the United States. So we have something to base it off of, which counteracts the other claim that a lot of Republicans have is we have no American data. Well, now we will. So that's the reason I propose changing it. I love the end goal, and Republicans don't even have to agree on the end goal, but we can get them to agree to start with primary care, because if it never goes past that, in their opinion, they can probably deal with that, is what most Republicans have told me. So that's where that comes in. So that's developing some sort of plan that's not just automatically socialized medicine as a whole, which to some of them is a bit terrifying, and they just need a little bit of hand-holding. Moving forward, the other thing that Andy Harris has not done is he hasn't produced really much legislation at all. He'll co-sponsor things here and there, but he himself doesn't develop things. I think the only thing he's put up is to rename a post office that he actually wrote. So you have someone who's ready to go with that legislation, which is different from Andy Harris who doesn't have anything and can say, I've tried this, I've done this, because he's just not done it. The other way to go is to start solving problems that Republicans didn't even know they had. I am certified in occupational hearing conservation, and I'm not going to lie, I like guns. It's a culture thing for me. You can ask me about how well I shot last time I was at the range shooting my Springfield XDM. I have no intent on hurting myself or anybody else. However, I do respect the Second Amendment. And the way we start to negotiate how to responsibly control access to guns and ammunition, that way we have appropriate people getting them, appropriate people using them who are respectful, responsible, and safe, as opposed to these people who are causing mass shootings. So they don't want that either, but nobody is willing to start bridging that conversation in a way that I propose. So we have two things. Number one, hearing. I plan to go after gun manufacturers to engineer down the sound of guns. Very simply, in one specific association, dementia is higher in hunters, and dementia is higher in anybody who uses firearms semi-regularly as a job or in recreational use. Plus, hearing loss is the number one associated condition with dementia. So if we think about it, these people, these guns who technology may have changed, but the noise level hasn't really come down like it should, they would have to get on the list to buy some sort of silencer, which by the way doesn't completely silence it, it just muffles the sound. And then they have to pay a lot of extra money for it. So we're talking, what, $150, $200 for a quote unquote silencer. Well, why isn't the doctor sitting in the seat looking after the ears of our 2A constituents? He's a doctor, right? He should be knowing this. I'm not bringing him up anything he hasn't already learned in medical school. So why am I sitting here and saying, hey, I see this, we need to work on this, which is going to improve your life, decrease your chances of getting dementia, and improve communication, because hearing loss, regardless of the reason, is a communication issue. And if I can't hear you or you can't hear me, how can I be sure that we're having the conversation I think we are? So knowing that all that kind of ties together, why isn't Andy Harris looking out for their ears? And the technology, if they can make a silencer, clearly the technology is out there. So that's something that I've gotten a lot of turnaround on, where people have literally been like, I never thought of that. I wonder why Andy hasn't done anything. So it's a conversation I've had several times with probably about 200 or 300 people, and it's gotten the response I thought it had. The other initiative I have is to get heavy metals out of ammunition. So that's lead, that's cadmium, that's vanadium, and that's bismuth. And I think there's one more I'm forgetting. But heavy metals, of course, if you're shooting and you're shooting for food, you don't know exactly how fast that's leaching into the animal that you're eating. Now, traditionally, we cut around where the entry hole is for the bullet, but are you certain that where you're cutting is removing enough of the meat so you're not being poisoned by the bullet itself?
Jen, we want to have time for people to ask you questions also. So if you have a couple more points to do in a couple minutes.
Nope, this is the last one.
Okay, great.
So the point with that is you don't know, because we don't have enough studies on that. So when you start saying, hey, if I can take this out and replace it with something that is equivalent in efficacy, and it's also something that's much more environmentally safe, so nobody's mining, we're reducing the ability to mine, or the necessity to mine it. We're reducing the occupational exposure to the people who are manufacturing these bullets. We're reducing the exposure to folks who are operating the guns. So we're doing all that, and then the technology that's currently out there when it comes to polymer-based ammunition is looking like it's going to actually be the same cost or cheaper for something that's they're essentially equivalent. So you're hitting them in a couple spots on that too. And that's how we kind of get those conversations started. So clearly I'm already talking to Republicans, and that's one of the reasons I changed my branding to put those things on the signs. They're very strong words, and they may not mean the same exact thing to me as they mean to Republicans, but it gets their attention and it gets them talking. And the way we win votes is to get them talking, because it's much harder to say no to somebody you know or somebody you've had a conversation with than not. So that's kind of the basis of where I'm starting with, and I'd like to go ahead and open it up for questions.
I'll start a 10-minute Q&A period. I think David Neff has his hand up, so we'll go with David first.
Jennifer, thank you so much for being here. It is so good to see you. My question is, Cecil County currently has a very serious drug problem. My question is, what steps will you take to help solve the drug issue in Cecil County? And what steps do you think we should do to reform the United States drug policy?
First of all, I'd like to start by working with law enforcement to get people from the point of arrest or point of detainment into rehab. That is the first thing we can do that's going to benefit everybody. And rehab, in many cases, can actually be cheaper than the actual cost of incarceration. So if this is somebody who we can deem to be reasonably safe to be discharged into the rehab from the custody of whatever law enforcement it is, that's absolutely somewhere that we should be looking into. It also means that we need to put more money into opioid addiction services, that we need to put more money into mental health services to begin with. One of the #1 things associated with addiction is another mental health issue, and a lot of people are just self-medicating. So we solve that by getting them the appropriate help they need, plus people who have more follow-up after being discharged from a rehab do better and tend not to relapse nearly as often. That money needs to come from the federal purse because not everybody can afford it in the individual states. And I think the federal government taking a strong stance on that, including items such as publicly available or trainable Narcan, that needs to come from the top down. That way we can have a strong lead and people know that our hearts are in the right place because it's about the individual and the government protecting the populace by helping the individual. I hope that answers that.
Thank you, Jennifer.
All right, do we have any other questions? Eunice, I see your hand is up.
You're still muted.
Hey, Jennifer, good to see you. I'm with you with Medicare. I think that we really do need to figure out a way to get that going. But the problem seems to be people wanting to hold on to their old insurance. How do we get those folks to opt in? Or how do we work it? Do we mandate it for all people?
Well, and as I said, with changing the rollout, the first change would be making sure people have access to primary care. This would allow us to slowly push out private insurance so that we're also not cutting off the, 4 million people that work in private insurance or associated with it. So we'll be able to move it in a different step. I like to refer back to Bernie Sanders, who is a very vocal member of the nursing caucus. And when he says brick by brick, sometimes his bricks are bigger than mine, but the concept is still the same. His brick for Medicare for all is one big one. I'm just giving him a different way to roll out from the blueprint. So being able to piece it together in a slightly different pattern instead of trying to drop it all at once is going to go better on both sides. Plus, insurance companies would be buying into this too, because they don't make any money off of primary care. They lose money in primary care. So getting to that first step to get them to back that, so that's one less thing they have to pay for, they're going to be happy with. And the people I've talked to unofficially about it have said, well, that's not a bad idea. And then as that rolls out, we can negotiate the rest of it later, because they know it's coming. They know eventually we're getting there. It's just getting them on board in a different way that's currently proposed. Because was it 7 of them? There are about 7 different proposed Medicare for all plans, but all of them do the same thing. They want to kind of drop it all at once. Nobody has propositioned this rollout, which I think appeals to everybody in the end game and then appeases the naysayers along the way.
Thank you, Jen.
Okay. Jenny?
All right, so thank you very much. Jennifer, I have a question that's kind of compound, so I apologize. I tend to ask compound questions. So regarding the environment, it's a pretty big and touchy point here in our county, but also across the United States. So my question is for you to give me an answer that's micro for the county, but also macro. As a congresswoman, you'd be responsible for creating bills or sponsoring bills or supporting them that are coming down the pike. And so my question has to do with the environment right now. As we've seen, we've had a lot of weather changes. We've had more fires happening on the West Coast that are now starting to creep in. We ourselves have been experiencing minor earthquakes and tremors here within the past couple of months. So what kind of actions would you put forward as preventative measures to prevent these kinds of things from happening in the future, such as the forest fires out on the West Coast? And what would you recommend to our own landowners here agriculturally to make those environmental changes that are necessary going forward?
Well, in a broad spectrum, in particular with forest fires, we need to go back from a fire prevention point of view. We need to go back to controlled burning of underbrush. That's something out in the Midwest they did away with in, I want to say it was the late 80s, early 90s. And that was a really big fire preventative measure. In controlled burns, there's also been some talk about whether or not we can harvest that energy and being able to funnel it in a different way. So I'm interested in what they come up with in those techniques, and it would be funding inventive ideas like that, where we kind of get around the whole problem of what do we do to control preventatively fires, because we have them even on the East Coast too. The West Coast just gets it a little worse because of the massive amounts of dryness they have in particular. The #1 fire prevention for specifically fires is getting out your underbrush and digging trenches. So since I can't dig trenches everywhere and still be environmentally friendly, the next thing is about clearing out the underbrush. So like I said, funding the inventive ways. That would also apply anywhere across the United States, because firefighting, when it comes to these disasters or emergency management of these floods, these fires, these landslides, and the devastation from these earthquakes, wreaks havoc on the emergency system. And being somebody who volunteers for their firehouse, I can see the direct relation, and I can see how those numbers go up. And NAFPA, which is our National Fire Protection, et cetera, I forget the exact thing. But they put data out on this as well that not a lot of people are associating. So it's cheaper to invest and make policies that lower the CO2 production, that lower the CFC's productions, so that they're not eating up our ozone and making alterations to our atmosphere. So that's talking about modifying the coal industry and trying to reduce the reliance on fossil fuels, et cetera, et cetera. So things that the previous president had balked at, those things we need to definitely be re-engaging with. And I appreciate that the Biden administration is working on that. I do wish that they were working a bit more aggressively, because I would be much more aggressive in that. But they do have a lot on their plate, so they're not even out of the first year yet. I got to give them a little wiggle room. The rejoining the Paris Climate Accords was very, very important on the global scale. If we expect to still be leading, well, we need to be at the table. And you can't lead without having a seat at that table and working with everybody else, because what they do elsewhere does circle around the world. And we found that, if everybody remembers, what was it, a volcano in Iceland like 10 years ago, shut down most of Europe's air traffic in Northern Europe. So something that's happening in a relatively isolated spot affected a great number of people and then affected flights around the world. So that was something you can point to and say, hey, this is, all this stuff affects whether or not we realize it. So as a nurse too, I know that the more disasters we have and the more logging and the more deforestation that would hold things in place, that continues to add to mudslides or in some cases the thawing with the avalanches on our higher peaks, like out in the Rockies. That means injuries, that means cleanup, and that's expensive when it comes to life, limb, and injury. So environment, protecting those, trying to keep logging down and out of protected areas, going back and reclaiming the lands that were opened up by the Trump administration and even reclaiming more of them. I love having Deb Haaland as Secretary of the Interior. I would say barely, I'm about an eighth Native American myself. So I kind of grew up understanding the importance of having somebody who values the earth first and who treats the earth like it's a living, breathing being, because in a lot of senses, at least to me, it is. So I would definitely be looking forward to promoting and putting through more policies that she suggests. Locally, I would love to see a bit more from, in particular, the EPA or from our state mandates when it comes to things like cows, which are basically very large cattle farms. I would like to see the regulation of the waste products from them handled like how we handle human waste, simply because when you're putting all that in one area, that literally naturally would not occur had you not shipped all the cattle in. The environment just can't handle it. We're not talking about small dairy farms or people who have maybe a couple head of cattle for personal use, because we still have a couple people around here who do that. Excuse me. So it would be really trying to police that, which you can do either at a state level, and eventually we can do that as well on a federal level. We actually have a lot of buy-in from people in agriculture, not just because they don't want things running off of their land, spoiling wells and such and spoiling the bay, but we have where they get their water from, their water sources that stem from in our area and states outwards. We can be poisoning their crops, we can be poisoning their animals. So they're very in check, and it's really just making sure that we're talking to them, explaining why we're doing things and getting feedback, because they are very receptive. They've realized over the past several years, I'd say probably from the late 80s, early 90s, that this problem isn't going away. And it's more of making sure we're keeping that open conversation. And some people don't feel that we're having that on a local level. So showing up. In the case, if I were Congresswoman, would be showing up and facilitating this, making sure that I can, put a meeting out in, Somerset and say, hey, I'm going to be here, my staff's going to be here. Let's go ahead and get this conversation started. So sometimes it's just being that facilitator to get those conversations started.